Hi, Newbie's Nurse Ruthy here. So I was in the middle of cooking here and just having like a flow of ideas. Hopefully I'm not going crazy. We recently had unfortunately, a death in our medical family. A paramedic, firefighter, he unalived himself. And he was the sweetest, so nice. He was like very hard worker. And it just made me think about, the mental health aspects of nursing. And, I found out via, where we find out all the news, Facebook, and the comments as far as what happened, that he unalived himself, because it didn't say that in the original story. But so when I found that out, that was even more heartbreaking, And all you see in the comments is like, oh, there's so many resources, this and that. But there are a lot of resources. But then I was thinking about like all the reasons why someone would not do it. Because number one, I feel like you can lose your license. They could try to take your job away. At least these are things that I think about. When COVID was around, I remember when I renewed my license, they're like asking all these psych questions. And I'm like, what's this about? And then later on, I find out that if you were to tell them the truth, they would actually make you do more education. It's like really require more education. Somebody tell me in the comments if that's true or not, because that's what I heard. I was like, what in the world? But it was really sad. It was super sad to hear that, someone that you see come in, they bring patients in, they're very smiley, they're very happy. You would never think, you would never think. I never thought this would happen, to him, but it's very unfortunate. I make it a point, like when a patient comes in and, we do our assessment, if they say yes, that I have previous attempts, I tell them I'm glad that it didn't work because I wouldn't have gotten to meet you. And I'm sure the people that knew you, when they found out, they were really pissed off at you. They were pretty angry at you, huh? So looking back, do you regret it? Do you regret doing it? And most of them say yes. So I guess just putting that perspective in their mind that they could have missed out on life and all the people that they would have left behind. Making chili, by the way. I felt like chili and cornbread. I guess the big take out of this is if you start having feelings, you start thinking hopeless, helpless, you start feeling like you're going down that rabbit hole, reach out to someone that you trust. It doesn't even have to be at work. I feel like shame comes with it. You're scared you're going to lose your job. Yeah, there's all these resources, but if you want to feel secure and safe, maybe somebody that's not in healthcare, maybe someone at your church or a friend's, they have plenty of 1-800 numbers you can reach out to and take your leave. Yeah, most places have 3 months. You don't even have to tell your boss why you're taking your leave, but you have to get yourself together. You have to get your mind right. And I'm just imagining all the things that he probably went through. You come up on horrible scenes of people or just terrible scenarios that I could not even imagine coming up on and being the first person there and having to manage all that. Then you take them to the hospital. Then the nurse and everybody's giving you shit because first of all, let's say you didn't call it in, or how come they don't have an IV, or what was their blood sugar, or like nitpicking little shit. In the end, we're all a team. We're all one big medical family. All have one thing in common, one thing in mind, and that's the best interest of the patient. So try to give your paramedics grace when they bring these patients in. And this does not only go out to EMS, your coworkers. Change a shift report, especially if you see the nurse had a terrible shift. Get the pertinent things, because in the end, you as the provider should be looking through the chart. All that does is just like a chip right off of them. It just chisels a little piece of them away, especially if they had a really shitty shift. They did the best that they could. And now you're coming and just reaming them over stupid shit. So because one day that's going to be you. One day that's going to be you with a crappy shift. And you're not going to want somebody nitpicking everything that you missed. I mean, of course, if it's pertinent, yes, but give them grace. I remember one time when I first became a new nurse, I was giving reports. She said, you know what? And it was bad. I got up at 7. It was like 8 or 9 o'clock. I was giving a report. And she's like, don't worry about it. She's like, wash this day out of your hair. And I was like, what does that mean? She's like, wash this day out of your hair. Basically saying, cleanse yourself of this day. And I still remember that 15 years later. I remember her saying that to me. So have that grace. But on the other end, don't be that nurse that just lets everything ride, waits for them. If you're sitting there talking for an hour and a half before shift change, that's a different story. Come on. Like, I've seen it happen. I've gotten a report. But even then I pick my battles. I'm like, you know what? It is what it is. That's a reflection on their character. I can't change that. And me saying something is maybe it'll make a difference. Maybe it won't. I pick my battles. So overall, newbies, OGs, if you are at that point in your life where you feel as if your mental health is becoming destroyed by where you work, you have to step away because it's not worth it. It's not worth you losing yourself and possibly doing something that you cannot change, you cannot reverse. In the end, we're all here to heal one another, to love one another. If you're in healthcare, you have to do this for love. You can't just do this for the money. You have to have compassion because you won't last. I'm going to put some links in the description with some help. I really hope that if you need help, you get the help that you need because you have to be here. You have to be the front lines with us. Okay. It can't just be me. It has to be all of us. We need some kind, some good hearted people here, that actually care and want to be good nurses and do good for the community. And remember, treat people how you want to be treated because what you put into this world is what you're going to get back. Have a great shift. Oh yeah, I want a big ass piece of cornbread.